Well, we're on our last lecture of the nursing process, and that's in Chapter 7, Wilkinson, Implementation and Evaluation. As intervention stated on page 102 in your Wilkinson, nursing interventions are actions based on clinical judgment. Well, basically your implementation phase is your doing, or you're going to be delegating. So when you plan for your implementation process or phase, you check your knowledge and abilities, you organize your work, you establish feedback points, you prepare the supplies and equipment, and you prepare the patient. And that's especially important to let the patient know exactly what you're going to be doing. You use all your cognitive, interpersonal, and psychomotor skills when you implement the plan, and you promote client participation, and you coordinate that care that patient is receiving. So we talked a little bit about delegation and supervision in our very first chapters that we went over. And so what do we think about delegation? Delegation, remember, is the process of directing another person to perform a task or activity. It's a transfer of authority or responsibility. The person delegating retains accountability for the activity, for the outcome of the activity, and that's by the ANA and the National Council of State Boards of Nursing. And as an RN, you're going to frequently delegate patient care activities to LPNs and to nursing assistant personnel. And depending on what state you're in, they may or may not be accountable for their actions. But it also includes supervision of those of the tasks that you delegated. So as I said before, you cannot delegate assessment, and you cannot delegate any intervention that requires independent, specialized nursing knowledge, skill, or judgment. There's 5 rights of delegation that you have to consider when you're delegating. The first one is the right task. That's the first question that you need to ask. Is this activity within your scope of practice to perform and delegate as your State Nurse Practice Act is defined? Is it within the LPN or the nursing assistant scope of practice? Is it in accordance with your agency policies? Is it performed according to an established sequence of steps and requires little or no modification from one situation to another? Does it not require ongoing nursing assessment, interpretation, or decision making? Does it occur frequently in the daily care of the patients on the unit? Does it have reasonable, predictable kind of results? Is it not one that requires independent, specialized nursing knowledge, skills, or judgment? Is not health teaching or counseling? And does not endanger a client's life or well-being? And those are all questions that you need to ask yourself. So we also need to make sure that it is the right circumstance. Nursing assistants are being used in a variety of acuity and technology settings. They are caring for a lot of sick patients. And so sometimes we think often of bathing, feeding, turning patients as tasks appropriate for the NAP. However, such tasks may not be appropriate if the patient is seriously ill. So when you look at the right circumstance, especially our patients that are critically ill are in ICU, and we do not have anyone but registered nurses with advanced degrees in certification, or master prepared nurses, or nurses that have taken special classes to take care of those patients. The 5 rights of delegation also state that you can delegate to a right person. So you must also be sure that the LPN is competent to perform the task, that the workload allows time to do that task properly. And you can also go back to your policy and procedure book when you look at the right person, because it will tell you on there whether it should be an LPN or an RN or a UAP that can do that activity. It should also be the right communication. Means that when you delegate, you should communicate clearly and specifically about each task. Explain exactly what the task is. Include specific times and methods for reporting the task. Explain the purpose or objective of the task. Describe the expected results or potential complications, and be specific in your instructions of the task. And the last item in the checklist involves supervision. Supervision is a process of directing, guiding, and influencing the performance of the delegated task. So when you delegate to an NAP or LPN, you or another RN must be available to answer any kind of questions and provide help if necessary. Sometimes you have to monitor the work of the LPN or the nursing assistant. Sometimes you have to intervene if necessary, and always give feedback. Evaluate the client outcomes and make sure that you ensure proper documentation. So on our ClickerCheck, it's a very busy day on the nursing unit, and the RN asks the nursing assistant personnel to complete the following tasks. He delegates inappropriately when asking the NAP to A. Make sure the client takes his pills after his meal. B. Ambulate the post-surgical client to the bathroom. C. Bathe the client who is listed as a fall risk. D. Feed the client with severe visual impairment. And hopefully you got the answer right, because the answer is medication administration is not within the scope of the practice of the unlicensed assistant personnel. Documentation is the final step of implementing those actions. You record the nursing activities and then the client's response to those activities. And that's done especially with our patient that if you have given your patient a pain medication, then within 30 minutes to 45 minutes you should be giving the patient, you should be reevaluating the patient. How are standards and criteria used in evaluation? Well, the ANA standards include a set of criteria to help describe the standard. And the criteria is measurable characteristics, properties, attributes, or qualities, and they're reliable and they're valid. So how do I evaluate client progress? Basically, you're going to review the outcomes. You're going to collect the reassessment data. You're going to judge the goal that was achieved and record the evaluative statement and evaluate collaborative problems. It gives you some really good examples of how to evaluate client progress, and it's on page 129 and between 129 and 130. Okay, so you can read that. You may even do, since we have computerized charting, you may have some outcomes that you have to put on the computer as you intervene and implement the plan of care. So we evaluate and revise the care plan related to the outcome to interventions. We draw conclusions about the problem status, and we revise the care plan as we need it. So our checklist for evaluating is we review the assessment, we review diagnosis, we review the planning outcomes. So it's all about reviewing those planning interventions and reviewing the implementation itself. So when we critically think about evaluation, we think about inquiry. We're noticing content. We're analyzing those assumptions and reflecting skeptically on how this plan of care has evolved through your patient. So in our ClickerCheck, the nurse has determined that the goal for a particular nursing diagnosis on the patient's plan of care has not been met. It will be most important for the nurse to A. Report this finding to the doctor, B. Note this finding in the client's record, C. Revise the plan of care, or D. Remove the nursing diagnosis from the plan. And the answer is, hopefully you got it right, is C. It will be most important for the nurse to review all of the other steps of the nursing process to determine if there were any errors that were made that prevented the goal from being achieved. Always go back to that assessment, and that's what she's doing. She's assessing and reviewing. There's some common errors of evaluation: failing to evaluate systematically, failing to record results, or failing to use reassessment data to re-examine and modify the care plan. When we evaluate quality of care in a healthcare setting, it's QA. Our QA goal is to evaluate and improve care provided in the healthcare setting, and it also involves evaluation of structures, outcomes, and processes in the healthcare setting. We'll be talking about quality assurance and management of care, but it's one way that we evaluate the plan of care and the patient care outcomes as it applies to the patient from admission to discharge. So here's some questions. Suppose your patient, Jeanette Wu, has become incontinent of bowel and bladder. Because she already has impaired skin integrity, the physician writes a new order to insert an indwelling urinary catheter. Urinary catheterization is a sterile technique, and suppose you've practiced this procedure in the skills lab but never performed it on a patient. And as a student, what would you do? And if you were an RN, what are some things you could do to assure that both you and the patient are prepared for the procedure? So that's something to think about. This is the end of the nursing process slides. These will all be available on PowerPoint, and I hope that you have survived these few lectures over these last 2 weeks. Best wishes, and we'll see you in class next week.